Okay. Letting everybody in right now.
All right. And we're streaming as well.
Okay, I'll talk to you later.
I'll talk to you later.
All right, bye.
Bye.
Charlie, you might want to make Maria co-host.
All right, done.
Okay.
Marie, I assume I am not running this meeting. I don't hear you.
Hi, I'm sorry. I thought everybody could hear me before, but I just had to call in on my phone. Can everyone hear me now?
Yes.
Oh, hallelujah. We're just waiting for. And okay. So if Martina shows up, she can chair. Otherwise, Yadidja will be up to you.
I will start whenever you tell me to start if you wish. When she comes, she can take over.
Sure.
Okay. In which case, give me a second to bring up the paperwork.
Yeah, there really is nothing for this meeting except the agenda.
Right. Could you please do a roll call and make sure that we have a quorum?
Sure. Okay. Hello, this is the Regional EMS Council of New York City's Ambulance Committee. It's October 26, 2020. Please respond when your name is called. Dove Jacob, Ari Weiss,
Present.
Grace Cacciola,
Here, good evening.
good evening. Mitch Powell,
Present.
hello. Daniel Mizell,
Present.
was that a yes? Robert Bristol,
Present.
John Johnstone,
Present.
Jerry Gelbard, David Mekatansky,
Present.
Travis Kessel,
Present.
Scott Olansky. Was that you, Scott? Choking? Scott Olansky? Okay. Martina Baccarella?
I'm here.
Oh, good, Martina. You could take over the meeting. Vincent Barranco?
Present.
Benedetto?
Present.
Hi. Yadidja Langsom?
Present. Glad to give it over to Martina.
Brian Levinsky?
Present.
Okay, one last time for Scott Olansky. Okay, so we have only one member missing. We definitely have a quorum.
Martina, we're at the very, very beginning. We are up to approval of the minutes. If you have your agenda in front of you.
Yeah, if you just follow
Really?
your agenda, we'll just go according to that.
Okay, I literally just ran downstairs from work. 1 second. Hold on.
Is Georgette in this meeting? Yes, okay. Martina, I just emailed you the minutes and the agenda for ambulance.
All right, I'm just going to take a look at that. 1 second.
That's okay.
Marie, you just emailed it to me now.
I emailed it like an hour ago, but I'm sending it again right now. There you go. Okay. So what I can do is just bring it up on screen. That makes it easier. That. Is everyone seeing the ambulance agenda?
We see your screen with email lists and stuff.
Okay. I don't know why it does this, but here we go.
There you go.
Okay, so Martina, you don't have to look it up. I just put it up on screen.
Okay, great, because it's not in my emails. All right, so good afternoon, everyone. Welcome to the ambulance committee meeting, Tuesday, October 26th. It's via Zoom. The agenda will be as follows: the approval of the September 23rd, 2021 minutes, the correspondence report. So, do I have an approval of the September 23rd, 2021 minutes?
Moved.
Anyone else?
Second.
Okay, great. Moving along. And the correspondence report.
Wait. Ask if anybody is objecting to it and then accept it.
Does anyone object to the September 23rd, 2021 meeting? Any objections? As I hear no objections, motion to accept.
I'll make the motion, Travis Kessel.
Thank you, Travis.
Second the motion.
Thank you. Okay, moving on to the correspondence report.
Okay. You want me just to read it?
Yes, please.
Okay, so as you could see, it should be on your screen too. FDNY is appointing Chief Stacy Scanlon as replacement for Chief Mazzola. That will be brought up at the council meeting for a vote. We received the updated ambulance operating certificate for Flushing Ambulance. Everybody should be aware that at this point, the New York State Department of Health is sending all the ambulance certificates electronically. We have several enforcements from the New York State Department of Health, several of which are for people here in New York City. Christopher Howland, he's from Amsterdam, New York, 2,000 civil penalty. Christine Correa, she's also a $2,000 civil penalty. She's from Brooklyn. Giovanni Gaviria, civil penalty from Flushing, New York. And these are all for 800.16, so we'll look that up and let you know what that is. Kevin McKeon is from Lynbrook, and his also a $2,000 civil penalty. Center for Allied Health, also, we finished their investigation with the Department of Health. Everything is done, and they were assessed a $2,000 civil penalty, but they're in good standing again. Oh, and this Giovanni Garvia, he was revoked. Sorry. He's also got a civil penalty, but his certification is revoked. He's from Flushing. Once again, we received assorted documents from Bensonhurst VAC that it's sending to Department of Health. And anybody who wants to see them, I'd be happy to email them to you. we received a letter, a form letter from the American Ambulance Association and the National Association of EMTs. This letter was sent to the federal government, U.S. Senate and representatives, alerting them to the severe shortages of EMS personnel and the need for assistance to increase salaries and increase reimbursements so that we can keep our EMS systems alive, especially now that we're at the tail end of COVID. Well, hopefully it's the tail end anyway. And for REMSCO, we had an email from James Downey, who was, again, questioning membership requirements. Okay. We did send a letter to the one BLS first response agency that has REMAC approval, operating without state approval, that's EMR. So we sent them the 60-day memo. And we also received a list of volunteer first responders and community safety agencies, which is a lot of groups. I didn't realize we had that many operating in New York City, but we can share that list, and we need to review it. One of them actually said that they're providing IV services in Staten Island. So I don't know. I don't think that they're operating under anybody's authority, certainly not ours, but we should at least know who they are. And that's the end of the correspondence report. Okay, Martina.
Okay, so then we're going to move on to the review application for transfer and operating authority.
Fortunately, we have no transfer of operating authority applications, nor do we have any applications for determination of public need.
Okay, and how about the ambulance committee tag reports?
Vinny Branco is here. Maybe you could, Vinny, just mention our short conversation on security stickers.
Sure. So myself and Marie had a preliminary meeting in regards to the tag sticker committee. We're going to get together and identify, hopefully tonight, one person from every sector, including OEM and NYPD. And we're going to follow that up with a Zoom meeting to discuss the tag report of the security sticker. So we did have a preliminary meeting, but we didn't get a meeting with the whole group. We need to identify the group. So with that being said, if we can have a volunteer from each sector, and maybe Marie, you could write down who will be from each group, and then we can get together a Zoom meet.
Yeah, please let me know. We need someone from each sector to be on this committee, so give me a volunteer or we're going to voluntold somebody.
I'll do it for the volunteer sector.
Who was that? I'm sorry.
Jerry Gelbart.
Thanks, Jerry. So, someone from the volunteers. Rob Bristol, are you able to participate? This is going to be...
As always, I'd be happy to.
Thank you.
Do you need someone from FDNY?
Yes, we do.
Okay. I guess tag I'm in.
Yeah, until Stacy gets officially seated, you're it. And it would be nice to have someone from the hospital sector.
Marie, Mitch Powell, I'll do it.
I'm sorry, who?
Mitch Powell.
Thanks, Mitch. Okay, so that looks good. We have everybody.
Marie, do you need me on it, John Johnstone?
Yeah, it would be great to have you on it.
Absolutely.
Okay, so we're set. We will be sending out a Zoom invite so that we can discuss the continued use of these security stickers, and if we do want to use them, what will be their purpose. That's what our meeting's about. And I will send that out. We'll pick dates tomorrow.
Yeah, I'll give you a call tomorrow, Marie, and thank you very kindly.
All right, no, thank you.
Thank you, Marie, and thank you, Vinny, and thank you everyone else for volunteering. Moving on to any unfinished business. Is there any unfinished business? And it looks like.
I want to mention two things. One, I did send a letter out to emergency medical rescue. Have not gotten a response yet, so I'll keep the committee up to date on what's happening there. Also, I sent an email to Dana Jonas to follow up on our Bay Community Volunteer, the CON that we did in July, where council denied the expansion. So we've been waiting to hear whether it was appealed or not. I'm pretty surprised that I haven't gotten an appeal yet. So I asked Dana to get back to me. It was pretty recent, so I'd be surprised if he answered me this quickly. But I am waiting for him to let me know what's going on. And
At Stemsville, they said they had about 7 appeals pending. They didn't list which ones, but they're probably over their head with this type of stuff right now.
okay. So I don't have any other unfinished business.
Okay. Any new business? Doesn't look like there's any new business.
Okay, for actually maybe it's unfinished, but I've had some requests from some members, some people in EMS to have the pods for vaccinations. I could let you know the New York City Department of Health really is not going to do that this time around because the boosters, the vaccinations are so readily available, people can just make their own appointments. It's not like it was when we first started where it was a limited availability and we wanted to get our EMS folks in. I have spoken to Dr. Schenker, who does run different clinics, and he sent me a link to request pop-ups, a pop-up location. So if anybody really feels the need for us to set up some kind of a pop-up site for EMS-specific people to get their boosters, let me know, and I'm sure we can set something up. I actually am going to ask if he would be around at the next REMSCO meeting in case any of our members want to be vaccinated.
Marie, it's Scott Orlansky. How are you?
Oh, hi, Scott. How are you doing?
Good. So Dr. Schenker's not yet joining, but
I'm here.
Oh, well, then I will let Dr. Schenker speak then.
Okay.
No, so Marie, I did reach out to the Vaccine Coordination Center for the Mayor's office. That's where that link goes to. So we're going to go down that route. I also have a call into DOHMH to see about them setting it up. One way or another, we can do it if there is a need. The question is just how to operationalize it, which those different forms will answer that question.
Okay.
So yes, the answer is we could figure something out, but we're just waiting to hear from the VCC if that process works best.
And also Marie, on a case by case, not if anybody before we get that sets up, if anybody before we're able to get the pod set up, if we're the pop-up set up, if anybody needs a boost or whatever, they can reach out to either to me or to Dr. Schenker, and we will gladly accommodate that at any one of our urgent cares or our mobile bus sites.
Okay. Thank you so much. It's nice to have an in.
No problem. We try.
Martina, this is Jim Downey. I do have a list of the appeals of REMSCO CON determination that was prepared by Dana Jonas at the Department of Health. And they have 2 for Lancaster VAC, Chautauqua County, municipal, and then Glen Oaks expansion of territory, Bay Community expansion, Bay Community expansion of territory, Forest Hills expansion of territory, and Ridgewood VAC expansion of territory are all pending.
Bay Community is also appealing?
It's listed here as someone has appealed Bay Communities. Yeah, I guess Bay Community is appealing their lack of approval.
Okay, that's the first we've heard of it. Usually we get some kind of official notification.
I'll email you a copy of Dana Jonas's report.
Okay, and that's from the last REMSCO meeting?
Yes.
Okay.
It was probably presented at the Systems Committee meeting.
But he didn't, I was there. He didn't give me anything. I'm a member of the committee. Could you send me a copy of it too, just so I have it?
Yeah, he listed, or he gave a number of the appeals pending, but he didn't list them.
Right.
So I asked him for a copy of his report and he sent it to me.
Okay, thank you.
If you can send me a copy too, please, I appreciate it.
Okay. Okay, Ms. Chairperson.
Okay, so that was unfinished business. Any new business? None? All right. Anything else I'm missing?
Now you can ask for a motion to adjourn until
6 o'clock.
Motion to adjourn, and I'll see you all at 6 o'clock.
Thank you.
Thank you.
I second that emotion.
Thank you, Vinny.
You're lucky. These have been easy meetings. Wait. Okay, everyone, we're going to shut down for 20 minutes until REMSCO starts at 6 o'clock.
Don't scare her off. Don't
Yeah.
scare her off. She's doing an excellent job.
I've had a rough start so far.
It's been fine. It's been fine.
Thank you, guys. We'll see you in 20 minutes.
Okay, bye-bye.
Maria, are you still there? Do you have the state report, or do I use my own?
You're going to have to use your own. I don't have a state report yet.
Is Dr. Krupe going to be around? Do you know if he's going to give the report?
I don't know if he doesn't come to, well, he does come to REMSCO. I'll ask him. Let me send him an email.
Right, because he is REMSCO's representative, so he should do it, not me.
Okay, let me shoot him an email.
Yeah, okay. See you soon.
Okay. Charlie, are you still live streaming on YouTube, or can you,
Marie, you want to take a look around the room and see if we have a unofficial quorum?
Yes, we have a quorum.
Okay, then in that case, let us begin. I'd like to call the October 26th meeting of REMSCO to order. We are operating under the governor's executive order that allows us to have a Zoom meeting, provided that it is both recorded and streamed live, which it is, as you can see in the upper left-hand corner of your screen. We'll begin with a roll call vote, Marie.
Okay, please respond when I call your name. Dove Jacob. Ari Weiss.
Present.
Grace Cacciola.
Present.
Bradley Kaufman. Samia McEachin.
Present.
William Goffin.
Present.
Daniel Mizels.
Present.
Robert Bristol.
Present.
John Johnstone.
Present.
Travis Kessel.
Present.
Jerry Gelbard.
Present.
Joseph Schenker.
Present.
Scott Orlansky.
Present.
Morty Lax.
Here.
Martina Barcarella.
Here.
Nancy Benedetto. Vincent Barranco.
Present.
Arthur Cooper. Robert Krupe. Megan Kessel.
Here.
Manfred Fuchs.
Present.
Sean Graves.
Good evening, Marie. Present.
Thank you. Jerry Gumbo.
Good evening.
Thank you. Yadidra Langston.
And
Brian Levinsky.
Present.
Dennis Laurie.
Present. Good afternoon.
Good afternoon. Dennis, Mitch Powell.
Present.
Okay, let me just go back to Robert Krupe. Arthur Cooper.
Yes, I'm here, Marie.
Okay. And Nancy Benedetto. She was here before. Okay. We have a quorum.
thank you. I would ask everyone to please mute yourself unless you're speaking, and whoever's running the meeting, please mute anyone who's not muted and should be muted. The next item on the agenda is the approval of the September 23rd, 2021 meeting. Was distributed prior to this meeting. Are there any comments or discussion? Hearing none, are there any objections to the acceptance of the meeting minutes? Are there any abstentions? We will therefore mark them approved unanimously. Thank you very much. We now move to the correspondence report. The office of the council received the following correspondence. Membership. Fire Department appointed Chief Stacy Scanlon as replacement for Chief Mazzola The alternate will be Chief Joseph Pataki. I believe we need to vote on that, Marie. Is that correct? Okay. I do not think we need a roll call vote for this. Is there anyone who objects to Fidney appointing Chief Stacy Scanlon as a replacement for Chief Mazzola? Is there any abstentions? Hearing none, I will direct the secretary to cast a single vote for Chief Stacy Scanlon. Thank you. Okay, no other information from Fidney EMS. From New York State DOH, we received the ambulance operating certificate renewal for Flushing Community VA 6734. We received a series of enforcements. Christopher Howland, 367340, $2,000 civil penalty for Amsterdam, New York. Christine Correa, 424165, $2,000 civil penalty in Brooklyn, New York. Giovanni Gaviria, 453942, revoked, effective 10/22/2021, civil penalty of $2,000 from Flushing, New York. Kevin McKeon, 144941, suspension stayed, $2,000 civil penalty from Lynbrook, New York, and Center for Allied Health, 08-091, $2,000 civil penalty from Brooklyn, New York. The EMS, New York State, we received from EMS agencies copies of assorted documents sent to the New York State DOH from Bensonhurst VAC regarding its suspension. We received copies of letters from the American Ambulance Association and the NAEMT sent to the U.S. Senate and representative leadership, alerting them to severe shortages of EMS personnel and need for subsidies to increase salaries. More on that in the REMSCO report. An email from James Downey questioning membership requirements. There is no new information from course sponsors. The office sent out agenda minutes and associated attachments for this meeting. A memo was sent to all BLS first response agencies operating without state approval, giving them 60 days. And that was sent out on September 20th, 21. And a list of volunteer first responder and community safety agencies from James Downey, on which we saw there are many, many more here than we thought are operating, including one agency that's going around giving IV by paramedics under apparently nobody. And I think we need to look into that as well. That is the correspondence report. Are there any questions on the correspondence report? Yes.
I just want to make clear that no agencies on that list have ever been approved by the Regional Council or REMAC in New York City.
Okay. Do we need to do anything to make sure they know they're not approved or send a letter to the state just covering us?
Yeah, I will send a letter to these agencies and copy the state just to let them know we're aware of them and that they need to get approval from somebody to do this appropriately.
Right. Okay. Very good. Are there any other questions on the correspondence report? Okay. Hearing none, we'll move to the staff report. Emergency preparedness update. Scott.
Yes, good evening. We were successful having FEMA approve the COVID mobilization activities last year for volunteers during the NAC activation. Each squad will be receiving an individualized email on what specific information we need to move forward to continue the process for reimbursement from FEMA. And special thanks to Jim Downey from District 4, Nice Vera, for assisting in the distribution of Narcan for the volunteer agencies for the past several months. And the report.
Any questions for Scott? Thank you very much for all that you guys are doing. Program agency update, Marie.
Sorry, I keep muting myself. I have no real new information for the program agency. We're going to be submitting our first quarter deliverables voucher to the Department of Health, but there have been no changes at this point.
Thank you. Are there any questions for Marie? Thank you. We now move to the ambulance committee report. Martina.
Hello, everybody. The ambulance committee met right before council, and there were new transfers of operating authority. There was also no new certificate of need requests. We did discuss ambulance security stickers, the TAG meeting. They will meet next week, or we will meet next week via Zoom. A BLS first responder 60-day memo was sent to Emergency Medical Rescue. And there are some open appeals for certificate of need on expansions, and that's for Glen Oaks Volunteer, Bay Community, Forest Hills, and Ridgewood. We also discussed vaccination booster sites. That's being discussed, and more information will follow. The next meeting will be November 16th. End of report.
Thank you very much. Are there any questions for Martina? Hearing none, we'll move to the Training Education Committee report. Who's giving that report?
The Training and Ed met the last 2 weeks on Fridays. We'll meet again this Friday. There have been many meetings in between where various groups are still working on completing development of the regional training for the protocol update. And that is the big subject. That's it. We'll be meeting again this Friday, and we hope to have it finalized in the coming weeks.
Thank you very much. Are there any questions?
It will also be hosted once again on Vital Signs Academy. I confirmed it with the DOH.
Okay, thank you. Okay, moving quickly along. The REMAC report.
Good evening, everybody. How are you? So, REMAC met this past Tuesday. This past Thursday via Zoom. There were no major action items at this REMAC. However, the Tuesday before, last Tuesday, CMAC met and approved the fire department rescue and HAZTAC protocols. There are 2 names that we are reviewing now for a psychiatric physician that will be hopefully presented to the next REMAC meeting and then the next REMSCO meeting for your approval. But that is the bulk of it. Any questions?
Wow, Joe, that's the fastest meeting you've ever had.
I know, it really was actually. There was a discussion of writing a letter in support or of vaccination versus non-vaccination in light of the mandate that's coming down. At this time, the REMAC is not taking any actions. This is the mandatory mandate that's coming for city municipal employees. There was a discussion by Dr. By Dr. Asada, thank you, sorry, I'm losing my mind, had a little stroke there, by Dr. Asada about things that we could do to help mitigate the loss of people with the mandate. And, some of the options that were presented were, there is the single medic option is available to him. That still stands as a temporary staffing standard for 911. And he, I think, is going to reach out to other hospital agencies as well, or hospital-based voluntary agencies to discuss staffing with them or additional units and so on. And that concludes the REMAC report.
Any questions for Dr. Schenker? Hearing none, we'll move along to the Quality Improvement Committee report. Who's giving that report?
I will give that report.
Okay, thank you, Joe.
So the Quality Improvement Committee has not met since the last regional council meeting. The major development since then is that the committee did appoint Dr. Lauren Kosturko to be a part of the committee, so she's been onboarded. The committee will be next meeting on November 10th, where we should have a full report on our quality improvement project to then present during the November REMSCO and REMAC meetings.
Are there any questions for the QI committee report? Hearing none, I'm going to set a world record now. State SEMSCO report. Is Dr. Krupe here?
Yes, I'm here. Okay, so I'll give you my report. I'm not as good a note taker as Marie. Okay, but she can grade me. Okay, at the end of this, I can add. Okay, whatever I forget. So, SEMSCO, you started out with discussion by Ryan Greenberg. Okay, and he spoke about EMS's contributions to vaccine sites, the discussion about diversions, ED turnaround time, and his mention of working on an app to show who's on diversion for emergency medical dispatches. There's also discussion about community paramedicine being up and running again, in the state's desire to have at least one service, community paramedic service up per county in New York State. There was discussion of remote learning issues. There was also mention of the PCR portal that the New York State Department of Health has, and how that has been working out effectively. There was discussion of vital signs at a meeting in Saratoga Springs, but you must be vaccinated to attend in person. However, there is a remote option. There were 17 names added to the EMS memorial. It was also mentioned new EMS certification cards are being sent, and that there are no extensions of EMS certifications going forward, as there were during the COVID surges. Also, as Joseph said, the New York City REMAC protocols, the HASHTAG protocol, and the rescue paramedic protocols were approved. The medical standards report to SEMSCO was really instrumental in this. Mentioned the need to revive the bylaws committee. So I imagine you'll be involved with that. Also there was a recognition of the need for statewide disaster protocols. There will be at Vital Signs a certified instructor update. Education training, Edie, Kiki mentioned that they're looking at providing for alternative sites, such as doctors' offices, for the 10 hours requirement that must be met. Finance committee, there was actually nothing new. Systems, there was actually the paper presenting EMS in crisis, which Marie sent out to everybody to look at. And there was also discussion about SEMSCO coming up with a white paper, to address some of the issues within. There's no for legislators. There was no motions. Safety. There was a discussion about resiliency, and developing peer-to-peer support. And I'll be happy to work with that group, on mental health issues, for EMS. Also, there are two new committees, subcommittees met for the first time: the Quality Metrics Committee, and the EMS Innovations, subcommittee. And they were asked to actually provide for mission statements, for their subcommittees, to know what their scope would be in the future. And let's see. And also, EC3, New York State will actually be rolling out a model that parallels CMS's EC3 program. They'll pay for treatment in place or bringing patients to alternate destinations. One would actually have to be enrolled in the CMS program in order to participate. And there was mention of a need for federal approval before applying at this state. Yeah, so you have to be in the federal program, CMS program, before you can start to apply to the state program. And all business, there's a 2019 workforce survey, and they're looking to issue a new survey in 2021. And they would like to compare the differences between those two surveys.
If I can just add one thing, they issued two new policies, one dealing with defining distance education and how that's to proceed, and the other to redefine how students do patient contact. In other words, it does not need to be necessarily in a hospital as EMTs get trained now, but there are other venues for giving students patient contact. I also want to refer back to what you mentioned briefly about in the systems committee. There was a very, very long and impassioned presentation about EMS in crisis. It went so far as to suggest that maybe the DOH is not the proper place for Bureau of EMS to be in the first place. Maybe it should be split over several other state agencies who might, quote, do a better job. And I thought that was a pretty strong statement to make at a SEMSCO meeting or at a systems committee meeting. Marie, I sent you a copy of the statement that was read, the several-page statement, as well as the booklet, EMS in Crisis. Maybe you can send that around. I sent it to you the day of SEMSCO.
Okay, I will check for it and I'll send it to everyone.
There's a very good statement listing all the issues. Many of them, of course, are upstate issues and not issues down here, but many of the issues are here as well. And it's clear that in the next year or two, we're going to have a disaster. We're not going to have enough people to cover the streets. Certainly volunteers, which is where a good deal of the state is dealing, users, they're going away, appears. And of course, fire departments would like to take over throughout the state over EMS agencies. So there's going to be a push for that. And they don't report to the Department of Health. They report, I think, to the Department of State, or I don't know what Finley, where the fire agencies report to. So this is going to be a major, big issue that we would be smart to get ahead of and to look at. So if you'll send those around, we can maybe discuss it at some future meeting. I think we need to look at that carefully. There was a very long discussion about whether REMSCO should mandate that all EMTs and all providers should be vaccinated, and that did not pass. Not because I believe the doctors don't believe that everyone should be vaccinated, but because of political reasons, the people in the state are frightened out of their shoes as what's going to happen if there's a mandate and all the volunteers stop being vaccinated, and that would not do very good. So I'm not sure what's going to happen there, but that was a very, very long and useful discussion to have. And it was nice to be in Albany, to do it there, to see people for a change.
I agree.
Yeah. Any more questions for Dr. Kroppi? I got to do something to prolong this meeting. Is there any unfinished business?
You did yet, Scott Orlansky. I just want to say one thing very quickly. We mentioned at ambulance committee that if any local or non-local EMS providers are having a challenge getting a booster or a vaccine, and they need one, they could feel free to reach out to me or to Dr. Schenker, and we will get them vaccinated in one of our urgent cares or on our mobile buses. So we just want to make that public if any EMS provider needs that.
Scott, you have a mobile ambulance driving around Brooklyn that could come by my house?
No, we work with New York City, but I mean, again, for you, we could work something out if you want, but not in a live setting.
Okay, thank you. Is there any unfinished business? Hearing none, is there any new business?
How you did here, Jim Downey. Just want to point out one thing. At last week's EMS briefing for leadership and providers, it was mentioned that EMS provider certification cards that have come out for EMTs do not say EMT, they say BASIC, B-A-S-I-C. And question about it. And Gene Taylor's reply was that this was a glitch in the program. BASIC means EMT basic, and they didn't know how many went out that way, and they have no way of going back and printing cards for those people that got it. Ryan Greenberg added that providers can send in an online form to request their card be reprinted. But if you take a look at the cards that the new EMTs are carrying around, they say basic on them. Nowhere does it say EMT or emergency medical technician.
Okay. Is there any other unfinished business? Is there any new business? Marie, please mark on the agenda that this meeting finished in 23 minutes.
I knew it was going to be a fast meeting.
Okay. Hearing no other new business, a motion to adjourn is in order.
So moved.
Thank you. Is there a second?
That motion. Second.
Okay, we are adjourned. Thank you all very much for doing this extremely expeditiously. See you in a month. Bye.
Thank you. Bye.
Bye.